It's Radio Free 501c, the podcast of Road Tulips Consulting. We're here with Season 7. So glad you're joining us. I'm your host, Cecilia Supp, CAEACNP, and I'm so glad you're here for this exciting year of so many great topics, so don't forget to subscribe. This week I'm joined by two Chief Staff Executives who are also first-time guests. I'm here with Adam Levy and Silvia Quevedo. They're to talk about an important study they did, sustaining the health of Chief Staff Executives. You don't want to miss this one. It's too important. It's April 14th, 2025, time for episode 281. Hey everybody, it's Monday, April 14th, and we're here with another episode of Radio Free 501c. Thanks for joining us, and to our global audience, good morning, good afternoon, or good evening, wherever you may be. I'm your host, Cecilia Supp. I'm the principal and founder of Road Tulips Consulting, and I want to remind you, if you haven't already, please subscribe or follow us on your favorite podcast service, because we are having a whole series of really important conversations this year with a whole series of first-time guests. And I'm very pleased to welcome two more first-time guests to the show this year on a topic that we don't take seriously enough. Our topic is sustaining mental and physical health as a chief staff executive. If you've ever had this job even once, like I have, you know this is an important study that came out of the Executive Management Council of ASAE, and my two guests are two of the authors of that report. And I am pleased to welcome Silvia Quevedo and Adam Levy. Welcome to the show. Let's start with Silvia. Could you say hello to the audience and tell us a little about yourself?
Hi, Cecilia, and thanks for having us on. This is a great opportunity to share some important information. I'm Silvia Quevedo. I serve as the Executive Director for Lamaze International. We represent about 2,000 childbirth educators, perinatal professionals. Lamaze International happens to be a client of Smith Buckland, and many of you are familiar with Smith Buckland, which is a professional services company, and among its business lines is association management. So that's me in 5 seconds or less.
Oh, that's great. Thanks, Silvia. And I'm so glad you're here with us today. Silvia and I met years ago, but just kind of circulated away from each other. So it's good to reconnect.
Great to see you.
And Adam, would you like to say hello and tell us a little about yourself?
Yeah, thanks once again for having us, Cecilia. I ironically also started my career at Smith Buckland, so when I connected with Silvia for the first time, we had that in common, although we never overlapped. Yes, my name is Adam Levy. I'm the executive director of the American Cleft-Palate Association. We are based in Chapel Hill. I'm a Chicagoan originally, and I've worked in association management or nonprofit management pretty much my whole career. My organization, also known as ACPA, is an organization of members who care for children and sometimes adults born with cleft lip, cleft palate, and other craniofacial conditions. We provide both sort of the professional membership side of things as well as public and patient resources at the same time. And I very much enjoy what I do.
Oh, that's great. Well, and welcome to you as well, Adam. And just full disclosure, I've never worked at Smith Buckland, just for the record.
Missing out. You're missing out.
We're sorry to hear that.
Well, maybe someday, maybe that ship will come in. We'll see. But I know they have a good reputation within the AMC industry, specifically, at least my experience with them. So yay. Oh, yay, Smith Buckland. All right. So now what we want to talk about, though, is a very serious topic, even though we're having a little levity. So sustaining the health of the chief staff executive. One of the issues, and I have had that job before, and I've also had the number 2 job before. So being in the C-suite's demanding in itself, but being the CSE, as we like to call it, is very isolating, and it can be very difficult to manage everything every day, all day long, and sometimes 7 days a week. So let's throw this back to Adam. So Adam, how did the council decide that this was an important study that needed to happen?
I would sort of pose this as one of those reverse reverse sort of methodologies in that we brought it to the council. I think that once they learned about it, they embraced it, which you would certainly hope they would, considering most are in those C-suite or executive roles. Where it really came from, where I think a lot of good ideas come from in the association community, is when colleagues kind of get together and kind of find common ground on something going on. And sometimes it's, how are you dealing with challenges to meeting attendance, or what's going on with international challenges here, or how are you dealing with certification changes in this environment? In our case, it kind of came from a group of people who have been dealing with some of those challenges that you alluded to a moment ago for a long time. And I think in different ways and different degrees. I'm a parent, but I'm not a mother. I work at a standalone small organization remotely versus a large AMC, with in-person requirements. We have different backgrounds of a variety of ways, and kind of what we all bring to this job impacts us differently. But the one thing that was common was that it is a job that can be isolating if you do not reach out to colleagues who have that same experience. As we always like to say, you can't necessarily be friends with your staff. Even if you do have a second in command, they are not in your seat, and you are not friends with your board and your board chair. We've seen where that goes for organizations where they are friends with board chairs. That can result in some pretty unhealthy dynamics in a variety of ways. I've witnessed that firsthand. And so we wanted to talk about, how do we face some of these challenges with others who understand them, while also addressing the fact that we know, or at least we had a gut feeling, that there were many others who were facing the challenges of what the impact is on us mentally and physically in this role, but either did not have resources, had not thought about seeking resources, or who simply put, felt isolated and alone and didn't understand that there were others feeling the same way. So I think that's where we started. And we sort of got this group together through our own connections, and began on this sort of path many months ago.
Yes,
And I
interesting.
will,
Oh, I'm sorry. I was just going to say, Sylvia, it's really interesting what you find out when you actually start asking other people what they're experiencing. How many
Right.
times have we found out somebody else feels the same way or thinks the same way? So over to Sylvia.
yeah, I just wanted to acknowledge our two other partners in this work, which include
Thank you.
Lindsay Currey and Tara Puckey. Lindsay Currey is with the Council of Undergraduate Research. And Adam, help me out with Tara's. We should have this front and center.
I should.
Tara
It's
is with the
the
broadcast.
Radio and Television Broadcast News Association. I'm going to go and say it wrong. Tara, I apologize.
Well, actually, I'm looking at the article that was published about your study, and it's
Great.
Tara Puckey she's executive director, Radio, Television, Digital News Association, and its foundation. So Lindsay and Tara were invited to join us today, but as they pointed out, CSEs trying to coordinate the same time to talk, almost impossible. So we do. Thank you both. I was going to mention Lindsay and Tara later.
Yeah.
So thank you for bringing that up, because all four of you authored this report, this article about the report that you did. And this was published in ASA's newsletter, January 13th of this year, 2025.
Yes.
One of the things, and Sylvia, I'm going to ask you how you feel about this. One of the things that it did show is that out of the 150 chief executives who responded, many are struggling with physical and mental health issues, including high levels of stress and burnout. That did not surprise me. But Sylvia, was there anything in the study that did surprise you?
Well, I think not much. Let me just put it that way. I think, as Adam indicated, we talked about this as a group. We all know we shared stories as relatively new chief staff executives, new CEOs in various organizations. And so some of this was not surprising, other than some of the data suggested people actually had suicidal thoughts. So I think the severity of mental health, and the fact that there were individuals that acknowledged via the survey that they did in fact have extreme self-harm thoughts. And just to set the stage for those that haven't read the article, we did this survey. It's a moment in time. It was conducted between February and May of 2024. It was done via approximately 24 questions sent out through LinkedIn and other channels. It was directed at executive directors, and we had about 150 respondents. And we did collect some demographic data that included things such as, gender identity, years of experience, staff size, and budget of the organization. So it's important to acknowledge that, as Adam indicated, we wanted to sort of get some data from our colleagues. It's a snapshot in time, and really at this moment, we're talking about potentially expanding it and considering adding on or taking it further. So I just want to point that out. But in terms of my surprise, not much, but other than, some of those folks who really sadly indicated there was self-harm. Now, what the survey, and I just, in terms of methodology, also want to be clear about, we can presume that among the respondents, there may be individuals who already carry a diagnosis of some kind, whether it's anxiety, depression, etc. That we don't know. We were really focused on mental health as it relates to the role of CSE.
Right. And, and then that's a question you might not think to include in a survey like that. So that's a good point. I'm glad you mentioned it's a snapshot. Unfortunately, I think it's a snapshot that we will see again when you do a refresh of this data. So, Adam, did you see anything in this data that surprised you?
I think I would say a positive surprise was how many people responded. Kind of working around your question a little bit with that response, but there are hundreds of people in the CSE seat, but it is not like there are tens of thousands. And so when we think about our community and distributing via LinkedIn and email, and I think maybe post on Collaborate, with the ASAE, I mean, I feel like sometimes within our own organizations, we'll get 50 people who respond to a membership survey or something like that. It's hard to pull information. This was a pretty personal kind of item. So the fact that we had that many people respond was meaningful. I think having 4 CSEs with lots of connections over time and through ASAE probably helped. People understood where this was coming from. It was not run by a company or something else. I mean, like, this was us investigating our own sort of micro community within the larger community. So that was nice to see. I was surprised to see what Silvia said. I think that was the most jarring for me. We had somebody come to us during the publishing phase of the results in that article, and they said to us, that seems to mirror sort of a general population percentage, meaning like 1 out of X many people have suicidal thoughts. And we said, so they said, do you really need to include that? Is that a relevant data point? And we said, it's not that we're interested in the general population. We're talking about our own population and caring for ourselves. We don't want to see anybody with these thoughts, at least as it pertains to how work impacts them. Sylvia, I think you made a great point. We didn't ask, there's quite a few holes, you could poke in terms of like a scientific survey. We didn't know if somebody already had, let's say, self-harm thoughts. However, would it be nice to ensure that if somebody is having those thoughts as it pertains to how their work impacts them or their balance, or not seeking mental health services because they're unaware, or their board doesn't support them, or they feel trapped in their job, et cetera, et cetera. Those are the kinds of things that I think really took me by surprise in terms of my own personal journey, knowing how much is available and how to seek help versus those who may not have that same experience or understanding. And then besides that, really just the amount of people who mentioned who mentioned like health issues related to their job. They directly correlated it to, it said in the past X many months, I feel like I have this. And, a lot of people had trouble sleeping or gastrointestinal issues or taking medication. Again, I think a lot of people do that anyway. We're interested in our specific population. And again, as it pertains to the support system around them. And then the last thing I'll say, and when I remember I highlighted this in like the initial report that I sent, and it was Lindsay Currey who had I would call the best reaction, although for the worst reason. It was that there was a clear disparity in the data of women who set aside time to take care of themselves and their physical health specifically. And it really spoke to the disparity. It was like 70% of men set aside time or a certain amount of time per week to care for themselves with physical activity, and only like 40% of women did. And again, we didn't, I think, dive as deep as saying, was that related to motherhood or other areas you could consider taking care of elderly parents, whatever it might be. But the disparity was, it was right in front of us. So not shocking, but sort of sad to see that it existed right in our community too.
I agree. Having been a chief staff executive once, I can relate to a lot of these things. I was very disturbed to see how many people said they had thoughts of suicide or self-harm. I think it says that we need to do something more for chief staff executives. We need to find a way to provide better support, better services, better education. I'm in a lot of networking groups, as I'm sure you both are, and I hear a lot of younger executives say, nobody really prepared us for this. Nobody tells you the real story. Everybody tells you how wonderful it's going to be and everything, but they're not ready for all the downside of it. It's like any job. There's good and bad in any job. It's great to be a chief staff executive, but then you got to deal with all the other stuff, like all the people needing things, wanting things, making demands on your time. My husband's a chief staff executive. He can totally relate to this report. He's got a very demanding schedule. He has a friend who is no longer a chief staff executive because this friend got tired of waking up at 2:00 in the morning worrying about his job. And I think the stress of doing that is really something we don't address well enough. And I think in my opinion, I think in our community, we do paint a rosy picture of being a chief staff executive and how wonderful it is without truly preparing people for that downside. So, Silvia, all that being said, and especially with the disparity between, men and women, not taking care of themselves equally, do you think that's because maybe were there more men responding to the survey than women? Or do you think that's just like a woman thing we just don't tend to set aside that time for ourselves?
I think the data is likely consistent, and I invite colleagues listening to fact check this. Women leaders, I think this is consistent with what we're seeing, not only in the association world, but, women carry the burden of family, whether they're mothers or taking care of parents. I think so I think that's consistent. And again, what we were trying to do is raise not just awareness, but to elevate the conversation, to normalize a conversation among chief staff executives that dealt with some of the challenges, the private and the quiet strain that we all experience, whether we're new or maybe 20 years in. I recall being told this is a lonely job, as Adam suggested.
I got told the same thing.
You do not have, no one's how do I say this? It's a lonely job. Now, I have the good fortune of being part of an AMC where there are other executives and there's incredible camaraderie, support, but at the end of the day, it's tough. So I think the data in terms of women and men, and I'm going to invite my colleague Adam to look at, I don't have the respondents.
It was very even.
Very even. Thanks.
Yeah.
Good. Okay, good. That's good to know.
Yeah. So I also think it's important to acknowledge that, some of what we wanted to do was elevate the conversation, normalize the conversation, and also talk about what can we do to improve this, right? Because It's not enough to just say there's a problem. I think it's important to suggest where there are solutions. Some of it, of course, is obvious, and this was brought up at a couple of our presentations around, well, you know, maybe this not everybody's cut out for this job, or maybe we need better onboarding. I think what's important for listeners that are not in the association space is there is a unique relationship in many cases where the CEO or the executive director is the one employee of the board of directors, and they report directly to the board. And that's unique in terms of its dynamic. The other piece is setting boundaries. It's so important as chief staff executives, new CEOs, whatever your title is, to set clear boundaries and to create a culture among not only your staff, but your board of directors, your commissions, your councils that protects your sanity, frankly. And how do you do that while trying to advance an organization? How do you do that when, frankly, when you're new, trying to prove yourself? These are the kinds of things we wanted to address. And finally, I will just say we're focusing on mental health, but as Adam indicated, the data also looked at physical health. Simple things, and I was guilty of this early on. Oh, I've got to schedule that gynecology appointment. Oh, I've got to schedule my, mammogram. Oh, I've got to schedule my doctor's appointment. And it just kept getting put off. And so even that, where you think, oh, that's fairly innocuous, I'll get to it. I mean, at the end of the day, that can mean the difference between, prolonged illness and productivity and health. So we just really wanted to elevate and keep the conversation going so that we can ensure it gets better.
Well, and I'm glad that you pointed that out because I believe this conversation needs to continue publicly. I think it's very much like the taboo many years ago where you didn't talk about the CAE exam if you didn't pass. Like people were afraid to say anything. And, I'm one of the people who got people talking about it publicly and encouraged others to say, because a lot of people don't pass the first time they take it. And now people talk about that and say, oh, okay, it's not a scarlet C on your shirt if you didn't pass the test the first time, right? And I think a lot of the problem with this conversation not being elevated previously is we took the attitude CSEs should never complain, kind of like the royal family in Britain, never complain, never explain, tough it out, keep going, don't talk to anyone. I think one of the other issues, and it's great to have your network of support, but the problem with that is they're not in the boardroom with you. You're there by yourself, and then there's the board. And then you're there by yourself with your staff. And I think we've all probably made that stumble a little bit of being too friendly with our staff or actually thinking we're friends with our staff at some level. We're really not, we can't be. We almost have to play a character as the chief staff executive because we have to play that role. But then how do we get that care we need? How do we make sure we go to the dentist, Silvia? How do we make sure we work out, Adam? I mean, what are some of those things? And I'm going to add this into the mix of that conversation, and we'll throw it over to Adam first. What if you work with a board in a profession or industry that thinks you should be on call 24 hours a day, 7 days a week because they don't understand your profession is different?
Yeah. I mean, I know Sylvia has some thoughts on this, so I'll add a couple of quick ones. So first, Sylvia alluded to this earlier. We all as a group talked about the fact that it's been a hot topic the last several years that executive leadership is transitioning. And shortly after the pandemic, we heard a lot about organizations needing to find new leadership and that it was a challenge. So in general, that sort of pipeline to leadership is a struggle for some organizations in terms of finding ready and prepared or interested people to lead an organization. And I say that because I've worked in associations now for about 20 years, and I've seen, cliche, the good, the bad, the ugly. I know of many organizations who had longtime executive directors, we're talking 20 plus years, who really struggled with transitioning into a new leadership model. And the reason is because I don't like to always use age demographics or age labels like younger. So I'll simply say newer, but what I really mean is kind of younger. Generationally, younger people are different with their boundaries. And I think a lot of longtime executive directors were in a role where they played friend, secretary, administrator, executive, overseer, operator. All those things came into play. And they were challenging for a lot of organizations when they changed what that model looked like and culturally how that worked. I've mentored a few people who have had previous executive directors, metaphorically or literally banging on doors to let them back in. They can't let things go, or the board says, I wish you were like this person, because that person isn't picking up their phone 24/7 or delivering that bottle of whiskey to their hotel room that they've been accustomed to for the last 20 years. Things have changed, I think, for executives, and thus certain boards have struggled with some of that change. And so I do think there is sort of a dual feed in some of these challenges as it pertains to board culture and executive culture. And then the other thing I'll say, I'm just trying to make sure, I want to give Silvia a chance, is let's see if I can collect my thoughts. You know what? I'm going to leave it there as I try to remember the other thing that I was going to say. Silvia, take over for me.
Yeah. No, listen, I think it's a fallacy to assume that quality leadership is equivalent to number of hours spent.
Thank you. Yes.
So I think right there, if there are boards or organizations that are demanding that, that's your problem right there. To be a creative, innovative leader does not require you to be up till 9, 10 at night responding to emails. So I think that's where any person stepping into this role needs to really think about leadership differently, and needs to train, educate its volunteer leaders on that, and set a boundary. This is a second career for me. I spent over 20 years as a medical speech language pathologist working in healthcare. So I dealt with stroke, head injury, and degenerative neurodisease.
Wow.
Trust me, most of our work does not demand nothing. The earth still rotates on its axis, whether or not I respond to an email at 8 o'clock at night or 6 a.m. So I do think it's important to set the boundaries and the culture.
Silvia, you reminded me of one quick thing, if I may, for a moment. We talked about this, and Cecilia, you alluded to it. I do think that executive fit and organizational culture are really critical when somebody's taking a job. You mentioned like a certain industry and what their expectations are, Cecilia. So I also think that's a good reminder that it's fair to say not everyone will care about some of the things that we're saying. Some industry cultures are more cutthroat, or there's different expectations, and some people thrive or fit into that, whether they either think they thrive but they're not, or they actually do. Everyone is different. So we also want to acknowledge not everyone needs to sit here saying, oh, I need to take better care or set better boundaries. If you work for a petroleum or financial X, Y, and Z association or organization, your board is probably going to be made up of more of those folks, and they may have different expectations. So I think in that capacity, it simply needs to be said that whoever takes on that seat needs to be prepared for that, or needs to prepare the board to have different expectations of them as a leader while still finding success. What I think all of this comes down to is something that the group of us four talked about, which is, where does our industry come into play with preparing, and again, you alluded to this, preparing newer chief staff executives for the role. I think some really interesting takeaways from the survey or conversations that came from it were industry consultants, especially recruiters and executive staffing firms. Where do they come into play with training boards and interview committees on what to expect, or what they should do to care for the chief staff executive? Where does this come into play in getting your CAE? right? I mean, none of this really comes into play when it comes down to the uniqueness of the role. Is there something there? What does ASA have to, what role do they have to play in all of this in terms of sort of the oversight group of associations as a whole? So I do think that foundationally preparing people for the role or establishing what the role means could use some attention. This is an industry that is unlike any other. We are 501(c)s for the most part, right? Or we work at a 501(c) or we serve a 501(c). We do not work for corporate boards. There is no shareholder, price that we're looking to meet. It's a completely different sort of world, and we feel obligated as CSEs to want to serve our members in the best way possible. And yet, if we work 7 days a week, 18 hours a day, generally speaking, there's no stock payout at the end of the month for $2 million or private jet to take us for that physical that we forgot to schedule. Or, in my case, I don't have an administrative assistant. I don't, there's no extra staff to help me out, to help put some things aside or remind me of my family obligations. So just because we have the title of CEO or executive director does not mean that we have the same abilities or role as another person who has that title, who might work at a 200-person association and has 2 admins and gets the assistance or whatever else they need. So a lot of uniqueness that could use some attention.
Yeah,
and I would just add, Cecilia and Adam, I think, and again, this was, as we said earlier, there are plenty of holes in the methodology. This is not, but we did want to ask our colleagues, hey, how are you feeling about this? I would venture that there is literature out there supporting this, even in the corporate world. It's a tough gig. So I think at the end of the day, there's a lot of positives. So anybody listening that's interested in aspiring to the C-suite, definitely continue. There's many rewarding aspects. But what we're talking about is leadership, right?
You're saying we're not trying to convince people out of this job right now?
We're not trying to do that. We're just
to be clear on that. Okay,
exactly.
Good.
We're just simply saying, hey, there can be mental and physical challenges if you're not careful and ready. And that we need to talk about this. People shouldn't suffer in silence. They shouldn't feel embarrassed that they can't say it because the expectation is you're tough. I've often said, and I'm sure I wasn't the first, leadership is about when everything is great, it's the team. And when the you-know-what hits the fan, it's you. And that burden can weigh on us. And right now, as we speak, we're still referring to the COVID-19 pandemic as an incredible disruptor, but we're living in a really chaotic geopolitical world right now. And so added to the mundane day-to-day challenges of any CEO or executive director are the sudden need to really engage in true, dynamic, innovative, creative leadership at a time that is incredibly uncertain. So, the tried and true metaphor reference to stormy seas definitely applies. So I think we're just trying to have the conversation and invite all of our colleagues to join us and think about, you're not alone. How do you set boundaries? How can we do better as a community to ensure that we've got people who are ready and fit to take on this role, even if they're new? What do they need? And yeah, so
that's important.
Adam, did I overstate that? But I feel like,
I think that's a very important point, because even somebody like myself who had been in this profession for many, many years, who felt like, well, I think I know what to expect, good, bad, and ugly, as we've been saying, because my attitude was they're in their Sunday best for the interview process and the negotiation process, but Monday morning, they're all going to be buck naked. And that was true. They showed up naked. And then that's when you start finding out all the stuff that you didn't even think to ask about. So I think an important lesson for anyone out there who wants to be a chief staff executive, I endorse what Silvia and Adam have said. It's really rewarding. It's personally challenging. You will develop a lot. You'll learn a lot. Some of the lessons are hard, but they're worth learning and then sharing with other people. like one of the things there's two things I learned that I would like to share that are really important. One, make sure your board understands those expectations, as Sylvia and Adam have said, of availability, and that you don't do what they do, you do something different. And no, they can't do your job just like you can't do their job. And the other thing is, if you do come to a contentious point in your CSE career where you have to part ways, I would recommend don't treat it like an employment issue, treat it like a breach of contract if things go badly. That was something I learned from my experience. It's not always an employment issue if they're not following your agreement or your contract, whatever that is. And that brings me to a third piece of advice, actually. Make sure you have an actual contract and make sure you have a lawyer look at it first before you sign it, because the letter of agreement I was handed was photocopied out of a book with fill in the blank lines on it. So I said, yeah, I think we need to formalize this a little bit better. And we did that over a couple of months. So those are some thoughts from my own experience. I want to thank Sylvia and Adam for coming on this week and discussing this really important issue that I, again, don't think we discuss enough. This is one of those things we whisper about, but I think we need to shout about it. So I always like to ask my guests, Sylvia and Adam, what's the one thought you'd like the audience to take away today? And how can they get in touch with you if they'd like to learn more about your experience, this report, or if you're going to be doing any further updates in the future? So let's start with Adam.
Sure. First, more than happy to be in touch with anybody. Sylvia used the word normalize a few times. I'll add that word normalize or even destigmatize. Big fan of all the health things myself. I put a lot of time and effort into that balance, or what I can, both mental and physical health, therapy, physical wellness, et cetera. So happy to kind of always try to help and offer context if I can. My email is executiveddirector@acpacares.org. And in terms of a takeaway, I have two quick ones. One, it reminds me that ASAE just announced the Executive Leadership Forum, and the topic was like executive caretaking. It was like, how do we take care of ourselves? And we emailed in our little group, and I think had like a little oh, interesting that this is coming up now from ASAE. Not claiming that we had something to do with it. But yeah, I think it's a rewarding job. My takeaway is simply that there is more to be done with the data that we collected as it pertains to putting the data to use with those who could have an impact, and how CSEs are hired and how boards are trained, which they are not usually trained to manage CSEs in that unique relationship that we talked about earlier. In associations specifically. Yeah. Thank you, Cecilia.
Thank you. And Sylvia, what's your closing thought, and how can people get in touch with you?
Well, first of all, thanks again for having us, and just want to reiterate, we're half of a larger team. Tara and Lindsay also are great resources. My takeaway is, listen, your mental and physical health is not replaceable, and definitely take care of it. Lean into the leadership and the boundaries, and spend some time really understanding the role you're stepping into and what it can mean. And I'm happy to share my experience, talk more about the work that we're doing as a group, and I can be reached on LinkedIn.
Oh, that's great. Well, thank you both again for joining me. This is a topic that's near and dear to my heart. And I'm so glad that people like you and Lindsay and Tara are bringing this forward so publicly.
Thank you.
Thank you for having us, Cecilia.
Oh, you're welcome. And I hope you'll be back in the future on with an update.
Absolutely.
Oh, great. Okay, well, we have to go rogue for now, but we'll be back next time with another exciting episode like this one. We're having deep conversations on really important issues this year. So if you would like to find this episode featuring Sylvia and Adam, you can find that on our website, roguetulips.com. You can also learn how Rogue Tulips can help your organization bloom outside the box. Don't forget to check out our education page if you're looking for a CAE study course, or that all-important ethics course, and ethics important all year long, not just in March. Also, if you'd like to find out what's on my mind every week, read my Going Rogue blog, which publishes every Friday. You can also sign up for our newsletter at roguetulips.com. Thanks again for joining us, and on behalf of Silvia, Adam, and myself, we'll see you next time. That's it for this week. I hope you really loved this episode as much as I did. Thanks for listening. Learn more about how our experience and knowledge at Rogue Tulips can give your organization the strategic edge to reach its goals. Check out our website at roguetulips.com. We'd love to talk with you and see how we can work together. Thanks.